I'm Cathy Dowling, Head of Midwifery within ABMU Health Board and co-chair of the Maternity and Newborn Clinical Workstream. My colleague is Simon Emery, who's a consultant obstetrician and gynaecologist, who's also the co-chair. We've spent a very lively afternoon looking at the case for change within maternity and newborn, and our remit is mothers, babies, in pregnancy, childbirth and up to 4 weeks in the postnatal period. Well, we've looked very analytically at ourselves this afternoon and we've covered some areas that we feel we're doing really well, and we have got really good quality services at the moment, but actually some areas where we do feel that we would like to improve on that. They're not just how we feel, but actually looking at some of our feedback that we've already had from patient experience groups that we've already got established within the health board, some of the themes from our complaints and incidences, which will help to inform where we go forward. So it is quite evident that there are areas that we could improve on. Some of those being particularly around capacity and demand. We've had some challenges with sustainability of some of our services in terms of managing the capacity, particularly around neonates. We've got babies being born at a much lower gestation now. We need to respond to the changes in sort of science in relation to babies born earlier and they survive longer. We've got a rising birth rate. We've got changes in relation to mums, less teenage pregnancy mums, but actually women in the older age bracket now having babies. So we really have to start thinking about how we're addressing some of those issues as we go forward into the next century, really. I think some of the things we've explored today is obviously what other factors may influence the sustainability of the maternity services, for example, other other factors such as what cover for paediatrics, neonatal rotas, what workforce will be available, how those rotas are going to be sustainable, because obviously we've got midwives and nurses, but we need medical staff as well, so we need the centres that are going to be dealing with the more complex mums and babies to have properly staffed rotas, and I think that's a real issue for us in how we take that forward.
And as a team, how enthused are you that you can actually make these changes?
I think we feel that it's a real opportunity that we've been given to actually look outside the box and think, well, how would we re-look at services and redesign? Change is obviously sometimes a bit scary, and no doubt that would be the same for some of the staff as we go forward, but we really see that some of this is going to be a positive opportunity to really analyse how we do things, not just from the patient's perspective, but actually from the staff as well.